which brings us on to the health service. I mean, we hear an awful lot of lefty whinging about the NHS waiting lists. Well, the answer's simple. Shut down the health service. Result, no more waiting lists. You see, in the good old days, you were poor, you got ill, and you died. And yet these days people seem to think they have some God-given right to be cured. And what is the result of this sloppy socialist thinking? More poor people. In contrast, my policies would eradicate poor people, thereby eliminating poverty. And they say that we Conservatives have no heart. Thank you very much.
Right, I'm on my way down to the start. I got my pig. I'm going to push that along the road with my nose. I've got knee pads, I've got gloves. Those gits at the BBC, 3 days running, anti-nurses story, saying that they're going on a safari. On a what? On a safari? Because they keep losing all the bodies. They keep losing all the patients. What? What? This is the day when they're doing Section 75 at the Houses of Parliament, the House of Bloody Lords. This is the day when they privatise, put the final nail in the fucking coffin, and you still... You should be ashamed of yourselves. This government... I've got the letter, which has been written on... which I'm sending. There's a couple of things in here. Look. 24th of April, David Cameron, 10 Downing Street. To David Cameron and his government. Just so you know, we think you are an evil, despicable person without a mandate, hiding in shadows. You produced a health policy that is abhorrent. To profit from people who are sick and vulnerable is inexcusable. The primary purpose of your government is to move public money into private pockets as fast as humanly possible, like pigs at the trough. What kind of people are you that would sell off services such as the palliative care of dying children? The way that the media and your PR gits have blinded the asleep public of this country by attacking nurses is obscene. Can you imagine paying for healthcare treatment? It's not about need, and you know it. It's about greed. You should be ashamed of yourself. We hold you to account. Yours sincerely, Mark McGowan, and I've got the signatures on my 2 children as well.
I don't go on that many demos now, not as many as what I used to, but when it comes to the NHS, it's absolutely the most vital demonstration that anyone could go on in today. Just to take a little bit back to what you said, though, that nothing's changed over the last 30, 40, 50 years. I think we have to actually look back at Thatcher and see a dramatic change from that point on. I do think it was different before Thatcher, and I think that was the starting point of what we're dealing with today. Yeah. So the NHS is the jewel in the crown, as far as I'm concerned. And I just think it's appalling that we feel we can cut the NHS or funding to the NHS when we're thinking of building Trident, which is probably going to cost us 100 billion. So that's my view. I'm not interested in defence when the NHS is being cut. So that's why I was there today. I want my kids and grandkids to have the same as what I've had.
Is that a commonly accepted theme? Do you think that Thatcher in the 80s was a big change in it?
Definitely.
Yeah. John Pilger wrote after she died that the main consensus after she died. When she left office was that she didn't change the philosophy of one party, but she changed the philosophy of 2 parties, and that when Labour got back into power, her ideology was accepted as that's the way it had to be.
I just bumped into Batman. He's got a nice little poster called Batman and Robin, You Blind. Bad banking practices and corrupt politicians, they're the ones that created this economic crisis, and they're making the innocent people in the public pay for it. Working class people, and we're not taking it anymore, and that's why tens of thousands of people are taking to the streets in Manchester.
It's a poem about nurses. It's called The Antidote. Nurses, hold in your hands cleaning up your blood and shit, cleaning out maggots from an infected leg of a man who's been brought in, who was living on the streets, and they put him in the bath and they washed it, and the maggots rose to the top of the water. Take you caringly through the birth of your child. Support families as the last hours of your loved ones pass away, taking you in so you can sit beside the bed. Nurses available for tears when you're told you have cancer. Give you telephone numbers for support. They work night shifts. Sit by the bed of your children when they're far away from home. Running, rushing from one patient to the next patient to the next patient without a break, without a cup of fucking tea. Working till they drop and going home emotionally broken in fucking bits to look after and care for their own family. And all of this for a fucking pittance. And right now, what they're doing, what's happening, what we're seeing is the destruction of the NHS.
Just gonna give the door a little knock. Right then, they've been told, they've been warned. They know, everyone knows now.
Bedford Hospital is an important part of this community. We all like the space, we all like the fact that it's down the road. There are things that are happening, but if we as Bedford people support and input into it, we need, to make a difference. We have our children's A&E back with us at the moment temporarily, so we need to keep that back, and we need to keep fighting to make sure that Bedford people have their own services.
Good morning, I'm in Bedford. I'm in Bedford for the Griffith Bank Awards art installation. The children's paediatric ward is going to be shut down, or closed down. That's what the 1st of August, I think it was. And the local residents of Bedford have been holding campaigns against it. They had a demo a few weeks ago. They had a march from Bedford Town last week, and today we're at Bedford Interchange Retail Park. A sick child strapped to a bed being driven on a journey the family will now face going to the hospital. So this is the bed. That's the child on the trailer, and it was joined on by the Luton People's Assembly. They decided that if they didn't stand up for Bedford Hospital, then it'll be another department another day, and if it didn't stop there, it then could be the hospital. And there's some of us from We Save People Not Banks were asked to come along, so we're here as well. And we've got about 20 cars or so, and we're setting off in half an hour to do the journey that families are going to have to face. The vital NHS service that's provided to the people of Bedford has been cut and closed.
Your health is important. Whether you 5, 10, 15, 60, 70, it's important to have those services nearby, because sometimes you think well, I'm in good health, nothing is wrong with me, but actually you don't know what happens down the road. The branch is not big, it's small, but they do a lot for a small branch and would like continuous support from the community. They do thank you for all the support we've had, especially with the pediatric campaign. So we'd like to thank you, for the continuous support, and hopefully this continues and we continue to build. Thank you.
Some people have said to me, why people from Luton getting involved in something that seemingly only affects people in Bedford after all the other things okay. But as today, all about tomorrow. And this week marked the 50th anniversary of Martin Luther King's I Have a Dream speech. In his final speech at the mountaintop in 1968, he talked about something that is equally or if not more important, and that was the need to stand together collectively against issues that affect everyone. He asked himself the question, what would happen to him if he stood up for the sanitation workers who were going on strike over the pay ridiculous? And then he asked himself, what would happen to the sanitation workers if he did not stand up for them? And that's basically why the people of Bedford decided to join up with the Riverbank War Group, because this is something that affects all of us.
department today, tomorrow it could be another department, and the day after that it could be the other thing. And Richard just touched on something about governments and politicians and austerity. They're managing to find plenty of money to go to war with Syria and spend money on millions on cruise missiles. They spend millions on air conditioning and army bases around the world. They can't afford money for doctors to provide care for our children. They can't provide money for our libraries. So this is why we're taking a collective stand. Recently with the decision to overrule the closure of Lewisham A&E department, that if enough people that care are prepared to take a collective stand, you can make a change. And in history, it's only the small actions of a dedicated group of people that have ever made change. I think in terms of, the NHS is it's a really important thing for me. I look at the attacks that are happening daily on the NHS, and the media's complicit in their scapegoating of nurses and doctors.
What they're trying to create is a scenario with Tories in which, whenever they've sold anything off, like the railways, like the pits, they always introduce a message of no hope. And they're doing it now with the health service. They're not going to totally privatise it this Parliament. Believe me, if they get in, it's goodbye to Nye Bevan and his great idea. And the local authorities will come in and say it won't be just cutting back and austerity. They've got 3 schools, they've got academies, and there'll be a lot more. They want to wrest all that area of education away from local authorities. That'll be part of their plan. And so that's why you have to connect the dots.
The biggest problem about the NHS, so my biggest fear is that there's not enough people of my generation that remember, well, we don't know what it was like to have to pay for doctors.
Well, I'm just told you.
And I don't think they appreciate, people that have private medical care now, it's a network that's backed up by the NHS. So even in terms of when the royal baby was born, Sky News was reporting that the royal baby was in a private wing of an NHS hospital, and if there were any complications, it had the full weight and resources of the NHS to fall back on. Well, when it gets privatised and sold off to the highest bidder, that support network won't be there, and the cost of going to see a doctor is just going to price people out of medical care, and it's a terrifying situation for me to think about. Future generations growing up without an NHS. I've benefited from it because my grandparents helped build and pay for it, and to think that grandchildren, if I had children, my grandchildren would grow up in a world without it. It terrifies me, to be fair.
Well, we have got a more right-wing group of Tory MPs than at any time since I've been in this building. That's 44 years. Believe me, Thatcher never had as many right-wingers as they exist today. And so they're in coalition. You're not been able to do all the things you want to do, but believe me, if they get a clear majority, you can get ready for some fireworks. And so age doesn't travel alone. It brings with it a lot of other complications. I've been lucky in life because the National Health Service has saved my life a couple of times with cancer and a critical heart bypass a few years ago, and so on. And so I remember that my time in hospital was not just about thinking I'd made it, I've got away with it, but it was also about speaking to all those nurses, asking them where they came from. So I was able to have a knowledge that there were 40 odd different nationalities in the London hospitals, which I was in for those few years, few months in those years. And I finished up, as I call it, a United Nations heart bypass. And when they talk about immigrants and all the rest of it, I think about my time in hospital, so I connect those dots up as well. So when you've lived a long time and you've been lucky, you can see the bigger picture and know that it's possible to win a lot of battles on their own, but you can make one hell of a difference if a lot more people are together.
protesting money was over 50,000 full. I wonder why the BBC looked right past it all. There's this prat called Chris Patton, he's an asshole. A Tory lord and works for Bridgepoint Capital. And guess what I'm gonna say, they own Care UK, the biggest private health group looking out for their pay. But look, see this punk chairman of BBC Trust, they don't wanna cover it, they just cover up. And this PFI scandal, they need to stop it, putting shed loads of public money into private pockets. 12 bill for privates to build with that. The NHS has to pay over 70 billion back. Now everyone's fear is becoming very clear. Jeremy steered the NHS into a deadly year. Now nearly 11 billion ready for profiteers, and many already getting contracts. Oh dear, Jeremy Hunt, sorry for my cough, I just had to clear it up. But we won't give the NHS up. It's not for sale, it belongs to us. Jeremy Hunt, sorry for my cough, I just had to clear it up. You got 900 grand and a fat tax cut. It's our NHS, bitch, get your hands off. They don't want no immigrants and no foreigners, so why the F are they selling to foreign companies?
He's going to join me on Wednesday. When I'm pushing the pig, he's going to be pushing his fire engine with his nose. Look, for sale.
That one day we'll come and have Coca-Cola written on the side of the fire engine. It's not a joke, this shit's real.
What's she got on the front? Look, privatisation. Wednesday the 22nd of May, 8 o'clock, outside number 10 Downing Street. Me and the firefighter, we're going all the way to the Bank of fucking England. Mervyn King, the man who this morning said, don't look at me, it's not my fault, it's not my fault.